Good evening, everyone. Welcome to our 14th session on caregiving in print and pictures. As you are aware, we have these conversations to try and understand how caregivers and caregiving have been spoken about in books, through films, and through stories that we hear every day, or through conversations that are brought to us. As you can imagine, caregiving is a social, culturally driven idea, and it has taken shape over a period of time, depending on how we have looked at it, what we have expected of it. The form and shape of caregiving has, of course, shifted over the many years, and this has influenced our thinking. In modern times, caregiving is changing shape again in terms of what is expected, how it can be done, and what is the best way, not just for the patient, but the caregivers themselves. I'm very excited that today, to further our conversation thus far, we will be having one of our mentors, Dr. Rajagopal, for this conversation. Compassion and empathy.
Hello, everybody, and
Dr.
thank you,
Raj,
thank
do you
you,
want to
Bhavana.
unmute yourself?
I did.
Compassion and empathy in healthcare is today's conversation. And as I bring Dr. Raj into bringing his perspective, his years of wisdom, and what led him to his book, I would like to take a few minutes to introduce to you Caregiver Saathi. Caregiver Saathi is our endeavor to support family caregivers by creating an ecosystem of well being and healing for primary caregivers, especially those caregivers who are navigating illness, chronic, or any other life limiting condition. Caregiving journeys require support and are unique and have multiple challenges. We would like to support caregivers during the caregiving journeys and beyond. How do we do this? We do this through sensitization, through storytelling, sessions such as this, a helpline, healing circles or support groups, content or communication, and finally, education through our programs. There are multiple resources that we have built so far, which include tech-enabled support through our app and website, our education through online and offline programs, community sensitization through podcasts, webinars, and various programs, caregiver coaching and family counseling, and finally, a volunteer base that supports caregivers by providing them training and emotional first aid. There are many ways in which you can be involved. You can be a part of our conversations, whether it is the conversations of gentle warriors or telling your stories through our podcasts, by circulating or sharing information about caregivers and caregiving and us, volunteering with us, partnering with us as an organization, and also working with us. There are many ways to join the group. Be a part of the healing circle, not just because you're a caregiver, but you're a well wisher. Support us by raising funds, collaborate with us, help us in our research endeavors, as well as become a certified caregiver Saathi. It is my honor and privilege to introduce to you somebody whose resume should actually run into multiple slides, but we will try and present it succinctly. Dr. Raj, as he's fondly called by many of us, is a palliative care physician from India, qualified from Trivandrum Medical College, Kerala, anesthesiologist by discipline from AIMS. While working as a professor and head of anesthesia department in Calicut Medical College, he and his colleagues founded the Pain and Palliative Care Society in Calicut in 93. By creating a palliative care delivery system suited to the Indian cultural and social background, it attracted international attention, and in the year 95 was designated a WHO demonstration project. I have to say that so many people during my journey directed me to Dr. Raj that I was really delighted to meet him eventually, many, many years later. Over the next decade, it grew to the present Institute of Palliative Medicine and a network of about 100 palliative care centers in the state of Kerala and prompted a generation of several outside the state. This initiative has now resulted in palliative care reaching about 30% of the needy in Kerala, as against the national average of less than 0.5%. 2003, he founded the charitable trust Pallium India, which has been such a beacon of inspiration and wisdom for so many of us, and has been successful in starting palliative care centers and establishing palliative care services across more than 15 Indian states. These are numbers that are large, and we are so grateful for the work that Dr. Raj has led. Currently, he is the chairman of Pallium India and director of Trivandrum Institute of Palliative Sciences. Dr. Raj is the recipient of Padma Shri Award from the Government of India, apart from national and international accolades. I am personally blessed to have his guidance as a mentor for Caregiver Saathi. The Hippocratic is a feature-length film exploring the life story of his acclaimed Indian physician, of him. Um, and today we will speak about the book that he recently wrote, which is Walking with the Weary. Welcome, Dr. Raj.
Bhavana, thank you very much. And everybody at Caregiver Saathi, thank you for this opportunity to be with you.
Dr. Raj, what would be your opening remarks for this session about the idea of exploring caregivers and caregiving through storytelling or through authors that have written about it?
Caregivers are the disenfranchised patients. They suffer. They suffer from a serious health issue if health is defined as a physical, social, and mental well-being. And including when I wrote that book, they are not in the center. The patients are at the center, as almost always happens, except when you and your organization give them the limelight. They are always the background. Their suffering is not acknowledged.
That is true. I suppose, we have all had periods when we are, when we are supporting someone else. So the job of a caregiver is to be the support for the person who's really suffering. And it becomes a little difficult to acknowledge your own suffering in that process. I would like for you to take us through the journey of how you reached the point of writing your book.
Bhavana, I felt I had a story to tell. Over 2 generations, I have seen healthcare being transformed from a service to an industry. I never heard the word healthcare industry till the 1980s. That would be about 30 years of my being more than 25 years of my being a doctor. I didn't hear that. And then we don't now talk about health service at all. It's a health service in the healthcare industry. That transformation also meant that people became insignificant. People are the patients and caregivers. Insignificant. The organs are important. The machines and the technology take center stage. Hospitals are important. The people become insignificant. And I thought I had this opportunity to bring to light the suffering of people and to remind anyone who would listen that by tradition and by definition, a healthcare provider's duty of care is primarily to mitigate suffering.
Mm.
And I thought I could say it by describing the experience of the people that I have worked with.
Yeah, powerful, absolutely powerful way of communicating the idea. And it's very hard hitting when you say it like this, that, increasingly the description is that of it being an industry, and that has its own implications. Um, for those who may not have yet read your book, which I'm sure they will pick up after this, um, uh, who is the book for? And why should someone read your book?
Anyone who has the courage to think ahead and recognize that every life has to go through a certain phase of illness and suffering. I say that who has the courage for a specific reason.
Hmm.
Very, very often, when I address a group of people, especially medical people, I ask them, how many of you are able to think about your own death?
Hmm.
Only about 1/3 of hands go up.
Hmm.
It's easier to suppress that thought.
Hmm.
And the problem is, it does come into everyone's life. Not only one's own death, but the death of loved ones also, illness of loved ones also. And you are not prepared. You are get devastated.
Hmm.
I think it's a huge strength to be able to think that we are mortal, that we will get ill. And maybe that's why the Bhutanese have this custom of every adult having to think about one's own death 5 times a day, every day.
Hmm.
Do you think that's morbid? I don't think so. Uh, they are reminding themselves that their existence is entity, and that therefore life is so precious. When you are
Hmm.
healthy, you learn to enjoy life, and you learn to do meaningful things with your life when you
Yeah.
acknowledge the temporary nature of it.
Yeah, beautifully said. I mean, I think uh, the two things that came to my mind as you were speaking was, a sense of gratitude would go up so much. And that is so important, as well as to have a sense of well-being, as well as, one would treat time as a precious commodity to do the right things, which is all great. So the topic, a walk with the weary. Tell us about the topic and what is the key theme, and why is it a walk with the weary?
It's about accompanying a person who has
Mm. Mm.
suffering related to health. It's not usually about curing. Contrary to popular belief, only 1/3 of all diseases are curable when you come to think of it.
Mm.
Yes. Okay, there would be a 1/3 that you can live with fairly easily, like your diabetes. You pop up a
Right.
pill and test your blood sugar and walk away. You keep checking your blood pressure and deal with that. There
Right.
are a lot of diseases that you can live with.
Mm.
And unfortunately, the 1/3, that's not statistically accurate, but roughly 1/3 would have a decline with ups and downs in between,
Mm.
ending inevitably in death.
Mm.
So we cannot cure all the time. So what happens, unfortunately, much too often, is that when a cure is not possible, you keep trying to cure. You keep pushing the medicine, keep more chemotherapy, etc. And the doctor may say, I think we should stop. And the loving family will say, no, don't give up. Don't give up.
Yeah.
But it's also about the medical system telling patients and families there is nothing more we can do. Take him home. And that's total rejection. I
Mm.
think healthcare system has to accept its responsibility
Mm.
to relieve suffering. And suppose even that's not possible, there are some elements of suffering, like the breathlessness, something of somebody with a interstitial lung disease, which can only be partially mitigated. And there, it's cruel to say there is nothing more we can do. They need you. I mean, the healthcare
Mm.
provider. And
Mm.
that's where, Bhavana, we have to walk with them. I'm not always able to relieve their suffering. In a certain number of people, even pain cannot be relieved adequately. But then I continue to be there for them. Bhavana, there was one person, I still remember her name, Patu, who had a severe pain in the neck, which made life very difficult for her, very poor woman. And she said, and the doctor said, no, surgery is not possible. This cannot be corrected. And as I would ordinarily do, I wanted to convey the bad news to her. And I said something like, Patu, I know that I have never been able to relieve your pain satisfactorily. And she held my hand, grasped my hand, and said, just don't tell me not to come back here. She needed me. She needed my colleagues. Because this was one place where people would not say meaningless things like, don't worry, don't think about
Mm.
it, grow up,
Mm.
don't be a baby.
Mm.
So this was one place where we would understand them, and walking with people like Patu is also part
Mm.
of my work.
Mm.
As far as they will let us walk with them.
Yeah, so I'm just thinking that more, both from the healthcare practitioner standpoint as well as the family, in a certain way, the desire to seek for cure is about saying that, if this person gets better, then I have to do less, or the pressure on me is less. So I really hope that this person gets better. Um, what would you say to that? It's difficult.
Bhavana, you should be answering that question. As it happens, I have had an easy life. I haven't really faced a traumatic death of a loved one. My grandparents and my parents died of old age without a lot of suffering. I've had it easy. So I don't know whether, as a caregivers feel, okay, he gets better, therefore I'll be it. Life will be easier for me, or maybe no. I'm
Mm.
sure that also might come in. But I really would like you to answer your own question as the
Uh,
expert.
yes. Thank you. But sometimes I feel that it's a little both. Sometimes it's just you just wish the other person will have lesser pain, and that by that extension, you yourself will have lesser pain. The easiest way is that you avoid it altogether. And I'm just thinking about our very, very courageous colleagues in the healthcare system who do this for so many people, not just a loved one. I'm sure people fall in love with their patients, and it can be very, very exhausting at all levels. What has been your experience, or what do you think? Why do you think the walking is less among the healthcare professionals?
First and foremost, all our training has been to diagnose and cure.
Mm.
You are asking us to do some things that we don't know what to do. Absolutely no idea. We don't even
Correct.
know that it's our duty. Nobody told
Mm.
us.
Mm.
5 years of medical education, 1 year of internship, 3 years of post-graduation. It's all about diagnosis and cure. Almost all. A little bit of prevention on the side. Nothing about walking with the weary. And therefore, people learn to stifle the compassion in them. Compassion is inconvenience. If they are hungry, too bad. You walk away because your medicine tray does not have food. Maybe also some people, a minority, it may be carelessness, but for the vast majority, it is the lack of ability to think in those lines and enact in those lines. And that's what I hope will change. As with the new curriculum from 2019, medical and nursing students will learn palliative care also.
Yes.
To a situation where somebody will be, for all practical purposes, instead of saying, don't just sit there, do something, here people will be telling them, don't just do something, just sit there, listen, hold a hand, wipe a tear.
And actually, that perhaps that's the more compassionate thing to do sometimes, rather than just act upon the person or the condition, is to just sit there and offer empathy. And so rightly said that sometimes if we are not brought up in the education system to have a certain type of skills, then it becomes that much harder. Um, I also find that one of the reasons for stifling compassion, or the dearth of compassion um, in some professions, is that you are you run out of it. So when you are young, you're probably able to offer more, and then you kind of see so many instances that it dries you up slightly. How can we replenish compassion in the healthcare fraternity?
Bhavana, don't you think the answer would be common, both for the healthcare providers and for the informal caregivers? Both can
Absolutely,
burn out.
same.
And for both, my own answer is to acknowledge my own frailty, acknowledge that as a human being, there are limits to what I can do and still remain healthy, and accept that limitation, to be able to say that I have tried my best. This is the best I can do, and get to bed, and also to share it with others. This, very often doctors are not comfortable to do it, but in palliative care, we make an opportunity for that to happen. To be there for someone else when they are overwhelmed, even to sit down and cry, and just being there.
In everyday language, we are often asking the informal or the, you know, unqualified caregivers, the family members who are caregivers, to be strong. There's an often refrain. I heard it a lot. Bhavna, you need to be strong. And therefore, the ability to acknowledge your own frailty can really, you can wonder whether you can do it or not. Because you have to be strong, not just for yourself, but for the ones that you love and for all that might come up. We also put our healthcare practitioners, especially doctors, on these very large pedestals. And then it can become very difficult for them to acknowledge their frailties or humanness. Um, what can we do to extend a humane environment to our healthcare colleagues?
To be able to share our shared frailty.
Mm.
I think what needs to be done is precisely what you are doing, Bhavana, with Caregiver Saathi. Legitimizing vulnerability, legitimizing frailty. When somebody says, hey, Bhavana, you will have to be strong.
Mm.
Where does that come from? That comes from uh, own feeling that, okay, Bhavana, I care for you.
Right.
I hope you are strong enough. You will be strong enough. The
Yes.
second comes out of helplessness. I don't know what else to say. I have to say
Mm.
something to get out of this place. And you say
Yeah.
meaningless things like this. Everything is going to be okay. Don't worry,
Yeah. Yeah.
etc. And be
Right.
strong. Be strong.
Right.
So the other person who is listening to this gets used to, he or she wouldn't know how to respond to that. The
Yes.
ideal response will be to kick the person on the shin and ask him to or her to go away, but that is not the done thing. So,
Yeah.
so you just give that inane smile and
Yeah.
stay there and just wish this person would go away.
That's right.
So you are advocating for
Mm.
the people who are walking with the weary while still weary themselves,
Mm.
and that is so frightfully important. Thank you for
Mm.
doing that.
Um, I am keen that although you have done this ad nauseum and many people who are linked with palliative care know this, but there are so many people who will be watching this. I want you to help them understand what palliative care is. A large number of people I encounter, including healthcare practitioners, who think palliative care is end of life care.
Unfortunately, yes, that's true, Bhavana. A
Mm.
huge number of our patients come to us typically in the last 72 hours of life. Unfortunately, because till that time, the family has not been able to accept the inevitability of the end. And also, the healthcare providers are unable to accept it. And the person who is suffering has not been given an opportunity to uh, reflect on it. They have not been given the truth. So, thank you for pointing that out. Rather than saying what palliative care is, we are starting by saying what it is not. It is not only end of life care.
Mm.
Then what is it? And it is not only for cancer.
Mm.
Why should there be a caste system among diseases? Whatever disease it is, suffering matters. So
Yes.
palliative care is prevention and management of serious health-related suffering, irrespective of the disease, irrespective of the state of the illness. So am I saying that it is relevant early on in the disease? Suppose somebody has a perfectly curable cancer or
Right.
a fracture. Would this be
Right.
relevant? He would say
Mm.
yes.
Yes.
That person with the fracture has horrendous pain. Why should that person be made to suffer it needlessly?
Mm.
This doesn't mean that he has to be referred to a palliative care unit. Let us have that very clear. I'm
Yes.
not saying that every person who is ill has to go to a palliative care unit, but I am emphatically saying that every healthcare provider has
Mm.
to incorporate the principles of palliative care into his or her own practice.
Mm.
And it is not a personal opinion. In 2014, the World Health Assembly, the decision-making body of World Health Organization, at its
Mm.
meeting, India being one of the parties to the convention,
Mm.
declared that palliative care should be integrated into all healthcare
Mm.
across the continuum of the disease from the beginning to the end.
Mm.
So that is palliative care. And of course, towards the end of life, it becomes more important and it may be the
Mm.
only kind of care offered to them at that stage.
Mm.
But it is certainly not only that.
Mm. Mm. Thank you for clarifying that. I think that it is important that all of us who are associated with the work that we are doing highlight this as much as possible, say it again and again till we understand it. That palliative care is holistic care, and we are interested that not just patients get palliative care, but the whole system that they belong to. And sometimes the primary caregiver can be so consumed that their pain might be invisible. But the whole system gets the support because illnesses can impact the whole family and sometimes generations. In your stories, I would like for you to reflect on those that made a deep impact on you. And if you could talk about the story in the light of what it left you with.
Uh, Bhavana, all of those stories are stories I think till I get dementia, I will not forget. But I must also tell you that I have not told the most painful stories.
Mm.
Mainly because I could not in any way take a risk of somebody identifying himself or herself with a story which they do not want to.
Mm.
Like a child becoming an orphan because the mother is dead, and kind of orphan because the father wants to molest her, that person. How about
Mm.
that? Would I ever be able to tell that story in public? I wouldn't, because how about that person? If whatever way I say, that will be horrendous. So I must say that I have not really told all the stories. There are only a few which have
Mm.
made me sleepless. Most of the time, I am able to live with it. Uh, the hardest for me are not those in whom death happens or happens prematurely. The hardest is when we are unable to relieve the suffering and the
Mm.
person dies in suffering, and then the caregiver has to live with that memory.
Mm.
You have gone through suffering in several generations, and when you look back at those people's experiences, it is a great uh, relief if you can think of the good times you have had together.
Yeah.
But when somebody dies in agony and suffering,
Mm.
those thoughts, the pleasant thoughts, get submerged, and the person has to always live with those horrible memories. So those are the hardest for me.
Yeah. Indeed. I mean, there. I think the pain is incredible when there are so many other things. And pain is linked with access to, pain relieving medication and opioids and its situation in our country. I would like for you to help us understand what is the state as you and your organization has been a pioneer and has helped us see the need for this so differently. So, could you just tell us a little bit about that?
Yes, Bhavana. A million people with cancer in our country, approximately a
Mm.
million, need opioids to go through life, the rest of the remainder of their lives.
Mm.
But before I go into that, let me also say that just liberalizing the law is not an answer.
Mm.
I might say that the answer lies in three sides of a triangle.
Okay.
The access to the medicine is only one of those sides. The other
Okay.
side is professional education and public
Right.
awareness.
Mm.
Even where there's medicine and the professionals are willing to give it, there are families who say, not morphine, anything except morphine,
Mm.
because they are scared. So public
Mm.
awareness and professional education. The other is the policy, which would be
Mm.
institutional policy and the governmental policy.
Right.
We have, I know of even in this century, early part of this century, I know of an oncologist who would say, we don't speak the M word here, M word
Ah.
being morphine. So there are these biases. People are medical scientists who read evidence-based medicine follow superstitious practices when it comes to opioids with some reason. Um, so the law in this country was amended in 2014 after 29 years of efforts by palliative care professionals. A
Wow.
draconian law was partially amended, facilitating access to opioids.
Mm.
But in our country, the law has to be implemented by the 29 states and 6 union territories individually. So it
Yeah.
has not been implemented in full anywhere, but some states come very close to it. It's still happening. The process is going on. We are working with governments and drug controllers, and there are some remarkable drug controllers who are taking the lead. They certainly have a role to prevent non-medical use or inappropriate use, but they also facilitate it.
Mm.
Uh, so the law has been changed. The implementation by state governments and union territories is slowly progressing.
Right.
But Bhavana, sorry, just one point. Uh, there is something called we call the principle of balance.
Mhm.
I, as the doctor who is prescribing that morphine, has not only the responsibility to make it available for those who need it, I also have a responsibility to make sure that I do it safely
Mm.
so that it doesn't destroy somebody else with an addiction issue.
Mm.
So I have to, we advocate for safe access to opioids for pain relief. The word safe is important.
Thank you for clarifying that. Recently, I was close to one particular case that needed, and the experience was that just access to the to morphine was so hard because the doctor prescribes it, makes it available through probably a provider, but Mumbai is a large city. Just making it happen, there are many hoops to cross, and the logistics can sometimes be difficult if the family is not well prepared. um, and that's where the anxiety and the pain of the family caregivers heightens, because they are probably doing things
Mm.
a little late in the day, not adequately aware, or they haven't been made aware through the people that they have interacted with. So, thank you for highlighting that. We hope that this will help clarify to many people to seek and understand how opioids can help relieving pain.
And
Going back to your.
sorry, Bhavana, I must add, for anyone who is listening and is worried about it, the way any doctor with training in palliative care will prescribe it, it would be safe. The risk of addiction is negligible,
Mm.
and it is and like medical people, I mean doctors, nurses, and others may fear serious complications. I will also add that the way it is used in palliative care, it's one of the safest medicines.
Mm.
The Brufen or Vovaran that you swallow unthinkingly is a much more uh, dangerous medicine in comparison. Has to be
Mm.
used with caution.
Yes, there's something to be said about how, there is a narrative or story around morphine that we need to dismantle, just as much as there is a story around, what is the gold standard of caregiving that we are trying to dismantle by telling the stories. As you, you chose the stories that you wrote about, you chose to highlight them, you chose to talk about them so that healthcare practitioners are able to get in touch with empathy and compassion. More than that, recognize that walking with the weary is as much the job, not so much the diagnosis and the cure. I would like for you to tell me a little bit about your reflections once you wrote the book. What do you feel as an author? What are your wishes for many such stories?
Uh, a whole new branch of medicine has evolved, Bhavana, called
Mm,
narrative medicine.
mm,
And many universities have that program, narrative medicine. The the today's way of handling this only with the brain,
mm,
that's dangerous.
mm,
When the brain is overloaded, my personal theory is that it just comes down and squeezes the heart. That's a personal story, and that's what happens to doctors like me with many degrees. If I am not sure, there's so
mm.
much of knowledge, there's no place for compassion. That's what I mean, it squeezes the heart. See, this is a risk. These narratives, when we force it, when we sorry, that's not the right word. When we make it visible and audible to the person on the street and to the healthcare provider, I think it can be very effective in conveying what the person with the illness and the caregiver go through. Storytelling gives relief to the person who tells the stories, helping me to uh, to deal with many other thoughts. But it is very valuable also for the person who is listening,
Yes.
preparing them for that journey. Even they may not think about it, they may not even acknowledge that they are being prepared, but when they come to it, they realize that some of those thoughts would be helpful. So uh, I wish I was an accomplished writer. This is my first book that of this kind that I am writing. I just started writing, and many people came forward and helped me to edit it and give it at least this kind of structure. But mm, but I think what you are doing is phenomenal, Bhavana. There's a story in everyone. Certainly, with everyone who has gone through an illness or who has cared for somebody with an illness. And sharing their stories encourages others to think. It heals them as they tell the story, but it also heals others. So I'm glad I wrote it. I am glad that uh, some people found it helpful. Um, I hope there will be many stories, narrations that will be more visible in future.
I really hope so too. One of our wishes is that, we find that there are so many more authors that we have spoken to on this platform, many from US, Canada, UK, and so few from India. I hope that your book and some of the others will inspire many others to tell their stories. As you are aware, we run this weekly program in which we invite caregivers to tell their stories. That is streamed on our social media platforms, and it is a conversation with gentle warriors. To us, caregivers are gentle warriors, and so many have come forth and shared their stories. And I'm with you. I would like to acknowledge you as well in that car's journey when you asked me, Bhavna, what's your story? I think it helped me see myself differently. It also helped me make a certain connection of affection and gratitude with you. So thank you for being a beacon of wisdom and light for us at Caregiver Saathi. And thank you for leading the way here as well. Any closing remarks for today?
Bhavana, you mentioned that journey in the car. I think we spent 2 or 3 hours in a car together.
Yes.
And one of the things that you gave me was the insight into how many generations can be affected adversely. And when unthinkingly a doctor advises another MRI scan just to see if it is progressing and touching the brain without thinking whether that's going to make any difference in the management,
Mm.
that doctor may not realize that one child in the home drops out of school at that time. It
Yeah.
affects generations, it affects your psyche. So, Bhavana, I think for caregiver Saathi to highlight these points is frightfully important. And thank you for doing that.
Thank you, Dr. Raj. I am looking forward to some of the new sharing with you, some of the new work that we have done. And thank you for your guidance and thank you for being the author of this very poignant book, which I hope that many will pick up and understand. This book is available. We will be sharing the details of the book. You can purchase it. Your contributions will go to support Pallium India, which is doing the incredible work of bringing palliative care to healthcare practitioners all over the country. Thank you very much. Have a
Thank
good
you,
evening.
Bhavana. Thank you.